Good afternoon and welcome to the Texas Oncology Foundation Survive and Thrive webinar series. My name is Kelly Condon. I am the program coordinator of the Texas Oncology Foundation. Today we are thankful to have Jackeline Castillo leading our discussion on managing cancer costs. Just to give you a little bit of background of our foundation, the Texas Oncology Foundation is dedicated to providing support to cancer patients in the communities where they live, work, and receive treatment. These Survive and Thrive programs are just one of the ways that we are active in communities, both providing resources and support to all who are involved in the cancer journey. And none of this would be possible without the continuous support of Texas Oncology. We are so grateful for their partnership. Just to give us an idea of who is on the call with us today, I'm going to throw out some poll questions. And we just want to know, like I said, who we have on the call with us today. So please respond. Are you a survivor, either in or post-treatment? Are you a caregiver? Are you a healthcare provider? Awesome. So we have a lot of survivors on the call with us today, which is really encouraging. And a few healthcare providers are with us, as long as some caregivers, so that's amazing. And the last question I want to ask everybody is, have you attended a Survive and Thrive webinar or symposium before? Basically any of our survivorship programmings. Looks like we have a lot of newcomers, so that is amazing. Welcome, and we hope that you enjoy this presentation and continue to come back for it with us. Before I introduce our speaker, just a few housekeeping tips. First of all, and some of you have already done this, which is amazing, if you have any questions for our presenter throughout the presentation, please utilize your questions tab on your control panel. You can type in your questions and they will add to our list, and at the end of the presentation we will ask our presenter to respond to those questions you have. So keep them coming as they come to you. If you are experiencing any technical issues like windows disappearing or your slides don't appear to be advancing, one of the best solutions is to simply close and reopen the webinar window. That will usually fix your issue. If you're having any audio issues, the best solution is to call into the webinar and listen over the phone. On your control panel, there's an audio section. You can select phone call, and this will provide the number that you can use to dial in. Lastly, this webinar is being recorded, and the online archive will be available for your viewing after this live version. Everybody who registered for this webinar will receive it in the follow-up email. But you can also find it on our Texas Oncology Foundation website. And so all of our archived webinars are there. At this time, I just want to thank Jackeline Castillo for being with us today. For those of you who do not know her, she is a cancer resource specialist with Cancer Support Community North Texas. She is very knowledgeable about the resources and tools that are available, and she does a great job of getting the appropriate resources to the patients and to the families that are in need of them. Jackeline was actually one of our first webinar presenters, so we are very excited to have her back. And Jackeline, I'm going to hand things over to you.
Thank you, Kelly. I want to thank Kelly and the Texas Oncology Foundation for inviting me back today to discuss what I think is a really, really important topic that doesn't get discussed as often as it should. So hopefully we can give you some good tips and suggestions as you kind of continue on your journey wherever you may be. So let's go ahead and get started. Kelly mentioned that I do work for Cancer Support Community North Texas. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. I want to mention this information, and hopefully you get to check us out on our website, because we do have 3 physical locations where we offer a variety of free services to anybody who is impacted by cancer. That does include the family. We are in the DFW area, so we have the Tarrant County, Collin County, and Dallas County locations. So hopefully you get to check out the website and find out more about our services and maybe come and meet me in person. So we are going to be covering a wide variety of different topics today. So I often get asked which plan is the best as far as insurance, which plan is the best for me now that I have cancer. So today we're going to be talking about why it's not as simple as picking one plan versus another, and really understanding the importance of all the available options that insurance have to offer, and figuring out what is going to be the best plan for you. You hear a lot of times when we talk about the people going through cancer treatment, you hear that while the symptoms and some of the processes may be the same, everybody's experience is different. The same goes for picking insurance plans. What one person will experience with out-of-pocket services and deductibles is going to be completely different based on insurances that you select. So it's really going to be incredibly important that you learn how to navigate through this, what can be a complicated system, but understanding what resources are at your disposal. So before we even start talking about the insurance and what it all entails, I always talk about the medical team, because when we dive into actual understanding insurance and understanding how it works, you really want to make sure you understand who is on your medical team. So besides the doctors, the oncologists, the other specialty doctors that you're having to go see, you really need to find out who in your clinic is there to help you as well. Whether that be nurses, nurse navigators, financial counselors, it's going to be different in every clinic because they're all created differently. So you want to make sure that besides the introduction to the doctors, that you ask who else is on the medical team. Whether that be nurse navigators, what is their role in that clinic? Are they going to be able to help you if you're struggling with some out-of-pocket expenses or concerned with appeals process? Is there a social worker that's there to help you perhaps to process copay assistance related to out-of-pocket expenses? And then definitely I always include family and friends. While it may not be a typical medical team, family and friends can go a long way in helping you to lessen the burden while you're going through treatment. One of the ways that I always recommend family and friends is if maybe somebody is very organized and can help you dealing with the insurances and the nuances of making these phone calls, maybe you can assign that person in the very beginning and call the insurance companies to sign HIPAA forms to give them permission to call and speak on your behalf. If you have one less thing to do, it's one less thing and one less stressor for you while you're continuing on treatment. So to understand the health insurance, I first have to talk about the hospital system. Now, understand that all hospital systems will vary in the way that they're set up, but the best way that I can explain the way that the hospital system works, the best example that I give is think of the hospital system like a mall. So in the mall, it's at one location, it's one campus. But within that mall, you have different stores. You have store A, B, D, C. And in those stores, they're all separate companies. So if you go to store A, and if you buy something, you're going to be charged and you're going to have to pay them. You go to all stores within that same day, you're going to have different bills and you're going to be responsible for paying all those services. Hospital is set up the same way. So if you go to the hospital, it's one campus, but within that campus, there are many companies that are contracted through the hospital or affiliated by the hospital. So that means typically things like companies like your oncology team, your facility where you go to get your imaging, PET scans, CAT scans, pathology, or any specialty doctors, like if you have to go see a cardiologist, are typically all going to be contracted. And so what one company makes up for insurance may be different for another company, even though you're going to one campus. So that's part of understanding where some of the complications may come in, and making sure that you're staying in things like in network. And so you want to make sure that although you're talking to one person in the hospital system and they're getting you help for services, does not mean that it's going to get applied to all the other facilities that you're going to. So you want to make sure and have good communication with all of these facilities to figure out who in that clinic you're going to have to access or talk to. So when we talk about insurance, we talk about, there's usually a lot of terminology. We have monthly premiums, we have copay assistance, co-insurance, deductibles, out-of-pocket maxes, in-network versus out-of-network. So we're going to talk a little bit about some of those things, but I wanted to mention a really good website that I've used, and they've actually just posted some new videos. Triage Cancer does an amazing job of explaining the basics of insurance. They have actually just posted videos. I am a big fan of videos or anything where I can see visually to help me understand. Know that when we start talking about these terminologies, anybody who has not experienced any kind of cancer or any major illness typically is not going to know what these terminologies mean. Ask questions. I do this on a full-time basis, and I can tell you that I still have questions, and there are certain situations or certain insurance plans where I still get stumped. So we don't expect you to know everything, and we want you to be aware of what your benefits are and understand how they relate to your out-of-pocket expenses. So again, kind of going back to that medical team, who in the clinic can help me understand what I'm going to be responsible for at this clinic and where I'm at with reaching my deductibles and my out-of-pocket max. Like I said, Triage Cancer is a really great website for you guys to reach out to. They have a lot of different resources and informations. I just logged on the other day because they downloaded another video specific to insurance and understanding all the nuances with that. So typically when we say that if you're intending on doing cancer treatment and you have to do surgery, radiation, or chemotherapy, you typically can assume that you're gonna hit your out-of-pocket max. So when we talk about understanding what the total out-of-pocket is that you're gonna be incurring, usually we can get an idea by looking at how much out-of-pocket your insurance says that you will be responsible for. When we talk about those who are in remission, those who are going to finish with all their treatment, but still continue to get yearly checkups from their oncologist or wherever specialty doctors they have to go to, they usually are not going to hit what's called their out-of-pocket max. So when you do get to this point, for those who are survivors and done with treatment, one thing to consider is maybe because you're not going to hit your out-of-pocket max, more than likely checking in to see how much scans cost at different facilities. What I would always encourage you to do is go back to your doctors and make sure that they're okay with going to a different facility, because sometimes they still want you to go back to the same one and make sure that you're getting imaging done by the same doctors. But if they're okay with going to a different facility, you can actually call your insurance company or log on. I have an internet account where I've logged on, and you can actually type in the type of scan, whether that be MRI or PET scan, and look at the different prices within the location or region that you live in to see if there's a price difference. I've actually done this a couple times as if I were to have to go do the scan myself, and there you will be surprised how much of a significant difference you will find within these facilities. And it really just boils down to what the insurances have contracted with these agencies that they would charge for services. There are also, I listed Healthcare Blue Book and Fair Health Consumer are also really great websites to go in and try to compare cost in your area. So definitely something to think about if you are done with all of your treatment and just going in for the checkups and the scans. Might save you a little bit of money in the long run. So when I talk about insurance, I always talk about explanation of benefits. So what is this? Why am I getting this? Why does it say it's not a bill, but I'm getting so many of these? This is really, really important, especially when you're newly diagnosed. You're being moved around to so many different clinics and so many different doctors that once these claims start getting processed, you start getting these very, very quickly. It can get very overwhelming when you think about having to process the fact that you have a new diagnosis and you're learning all this new terminology related to the cancer treatment, and now you're getting all these bills and you're having to process this as well. So I got this image of an explanation of benefits off the website because I wanted to try to walk you through it a little bit to see if it helps you to understand it. So yes, it is not a bill, but it's definitely something you do not want to throw away. These are going to be forms or papers that you're going to line up with the actual bills that you get from the clinic. Well, why is it important for me to even look at these, Jackie? Well, when we talk about the services that are being billed, the people inputting what was actually done, the service, the actual medical code, these are human beings that are putting in codes. And a lot of times there is a potential for human error. So you want to make sure that whatever service was provided to you that day, that you were correctly billed for. Much in the same way that if I went to the grocery store, I always get an itemized bill. I would expect to check it, make sure that it was all processed correctly. Same thing with this. I want to make sure that whatever service I was provided that day, that I was billed correctly and that I'm not being overcharged for something. This is something where you can easily check it and where you can quickly catch any mistakes. If at any point the explanation of benefits doesn't match with the clinic bill, this is something where I would want to stop before I even make a payment, call the facility, and figure out where the mistake happened. A lot of times it can be as simple as they put in the wrong code, or maybe you were scheduled to do something like chemotherapy that day, and perhaps after they did the blood work, they found that your blood counts were too low and they canceled it, but they still charged you for the chemotherapy. Well, obviously that's something that needs to be taken off and something that can be handled pretty quickly, but it's something that may not be caught by the billing department if they're doing automated pay. So on this example, on the number 2, you see the actual service that was provided. In this case, it was an immunization. And then number 3 provides the date of service. This is really important, especially when you're being moved around from doctor's appointment to doctor's appointment. One of the things that I always recommend, because you can quickly forget what day you went to which doctor, get a calendar and jot down on the calendars what days you have the doctor's appointment. And on the day that you go to the doctor's appointment, write down a quick note of what it is that you did. whether it was just a doctor's visit or if you did lab work or chemotherapy. This is a great way to go back and reference what actually happened that day, especially if something like chemotherapy or imaging gets canceled because something wasn't working, which can happen quite often in some situations. You can quickly reference that and just say, I looked on my calendar, I didn't have that done that day, and they can go back and reference in their notes. So the number 4 section is what typically the companies will actually bill. And then in the middle section, 6, 7, and 8 is usually what the discounts are being provided by the insurance company, how much you potentially owe after they have done the negotiation. Towards the very end, number 11, you see where it says amount not covered. In this case, immunizations typically are covered by your insurance providers. So this person does not owe anything. If you actually go down to where it says my deductible summary, that's right above the 13, this person has a deductible of $2,500 and they have met 500 of that. So in this case, if it was something that they were would be responsible for paying, which it looks like they were billed $53, because they have not met their deductible, they would be responsible for $53. So there's a lot of information, and a lot of times it may seem convoluted, but it's just figuring out where you need to read through and see what it is that you have a responsibility for and where you're at with your deductible. So another thing that can come up with understanding insurance and in the insurance process is appeals. Typically, most clinics and oncologists or doctor's office are going to be the ones to handle this. But there are some situations where you need to understand what the appeals process looks like and what you can do to help advocate for yourself if needed. There was a perfect example in our area where I reside in the DFW area. On the news, there was a reporter that talked to a patient who has been diagnosed with cancer, who the doctor approved a chemo regimen, and they've sent it in for insurance per approval, and it was denied. And I don't know what all happened in between, but I know that there was a period of time where about a week or 2 weeks that nothing was happening and it was still in denial mode. This newscast went in and did some research, and they called the insurance company, and they quickly realized that it was a mistake and that it had been approved all along. That is a perfect example of where you may be able to advocate for yourself, and instead of waiting and assuming that the clinics are going to do it for you, maybe you can take that extra step and find out if there's something that you can do on your end to speed up the process, especially when it comes to things like starting regimens like chemotherapy or radiation or surgeries, which typically all need some kind of pre-approval. So when you get a denial, you always want to attempt an appeal. But before you start the process, like I said, you always want to make sure and check in with your medical team. So if it's the oncologist's office that submitted the claim and it was denied, then let's go back to the oncologist's office and say, look, I got a denial. What's going on with this? I would say 9 times out of 10, they're already on top of it and they've already submitted an appeal on your behalf. And usually by the time you're getting the written documentation, they have already done the back end and the legwork for you, and they have overturned the denial. So usually if it is something that you are going to have to do on your own, most insurance companies will require that the appeal be initiated in writing. And it is time sensitive. So you want to make sure that you're opening all your bills and you're actually reading what it is that's in all of these bills. I know, again, it can seem very overwhelming when you're getting 5 different bills from different companies, but you want to make sure that if you're not able to do it, that maybe a family member or friend can take that on to help you organize this and keep track of it. Because if you do go through that time frame where you were allotted to file an appeal, there may be nothing that you can do after that appeal time has passed. You know, making sure if you are going to file an appeal and you have to do it on your own, an example of something that I would tell you that you might have to do on your own. I had a situation where a patient was ordered by a doctor to do lab work to do a special kind of test. This special kind of test had to be sent out to an off-site lab. The lab was done, the test was done, she got her results back, and the bill was not processed by the clinic because it was sent to an outside lab. The lab that did the blood work processed the bill and the claim. What ended up happening in this situation was that her insurance or her provider said that the lab was out of network. So she was responsible for 100% of the bill, which I believe when I talked to her, she said it was a couple $100. It can be a lot of money that can add up very quickly. She had to file an appeal, and she got a doctor to write a letter explaining why they needed to send this lab or this blood to that specific lab work. And in the end, it ended up being overturned. So something simple where they just have to explain why they're doing it, why they're sending out to this specific company, that they can look at it and reconsider. Again, a lot of times it may be a coding error, or maybe that they just need more information. So if you do have to start this process, if your insurance is connected with your job, do you have an HR department? Usually within the HR departments, there's a benefits counselor. Can they help you file an appeal? And I would want to get the HR department involved, because if they understand that there's any concerns or there's been any delay, and if they're seeing consistently that there's delays across the board with all their employees, then it may be something that they need to be aware of to figure out if this is the best insurance moving forward if they continue to have problems. If you have specific questions on if you're wanting to write a letter and what needs to be included in that letter, Patient Advocate does an amazing job of giving you sample letters on the insurance appeals. A lot of times when we get denied something, especially as critical as medicine that can keep us alive, emotions can go high. So you want to make sure that instead of, you definitely want to document what you're feeling about this. You want to state the facts, because the facts is what they're going to look at and what they're going to address to determine if they can overturn the appeal. Texas Department of Insurance, every state has it, and you can always reach out to them for appeals questions, how to start the process. They're always readily available to answer any of those questions. And then definitely, if you're a state employee, maybe reaching out to the state employee website and their phone number to have them help you with some of the appeals. And usually, if you're getting the HR or the state representative in charge of whoever's in charge of the insurance, a lot of times, because they're getting involved, sometimes they can overturn things a lot quicker than you doing it on your own. So again, doesn't necessarily mean your medical team doesn't necessarily have to be in the clinic. It can be somebody connected to helping you with this process. You also want to make sure that with your actual insurance plan, maybe check in with the insurance company to see if they have, it could be a caseworker, it could be a nurse navigator. They're called different things and they have different titles, but if they do have that option for you, you can ask to have one assigned to you specifically. So if there is a problem and you're having to call insurance, instead of you calling the 1-800 number and reaching Mary Jane this time and John Doe next time, and having to re-explain your story. Maybe if I get one person assigned to me, then I have Jackie who I can call, and Jackie knows my story. I'm not having to re-explain it over again. And maybe she already knows the doctors that I'm talking to, and she understands the situation, and she can quickly, because she works on the insurance side, can quickly call and talk to the doctor's office and maybe get the problem straightened out. So lots of different ways to kind of access different kinds of support and help. So there typically are two main types of appeals. They have the internal process, which is the process that you would go through your insurance company. And usually, I think the last time I checked, it could be different for others, but there's two opportunities where if you get denied, you can apply again, and if you get denied, you can apply again to that for an appeal. There is also what's called the external review. This is usually reserved if you have been denied in the internal review process, or if the denial is for a life-threatening condition and you're needing something urgently. If you go through this process, you have to fill out specific forms, and you can actually find those on the Texas Department of Insurance website that I've actually listed here. You can find those forms to start that process. You do have to fill out paperwork and submit it so that the insurance company knows that you're wanting to request an external review. Basically, what it boils down to is if you go through this process, a third-party neutral company would come in, review your documentation, take a look at what the insurance was saying and why they denied it, and make a determination on what needs to happen. If they decide that the appeal needs to be overturned, the insurance company would have to follow whatever the external review board decides. So prescription drugs. This can get really complicated a lot of times depending on the type of medication that you're taking. You know, you have your out-of-pocket max, you have your deductibles, but then you have, depending on the type of plans you have prescription drugs that may be separate in some instances. So this is part of the insurance that you really do need to understand and make sure that you're communicating with your doctors. So one of the things that, in understanding the prescription drug plans, how it works, why is it that I go to the pharmacy and this drug costs $4, where I went to the pharmacy and I filled another prescription and they're charging me $900 to fill this prescription? Why is there such a huge difference? So every insurance company determines, and they have what's called tiers. So they are the ones that assign how much each drug is going to cost. So they put them into what's called tiers. So typically drugs that have been on the market for quite some time, maybe generic drugs, they typically are going to be less expensive, and they're going to be on a lesser tier. Newer drugs, specialty drugs, they may be higher, much higher, because they just came on the market, or they are usually drugs that don't get filled very often, so they're going to be typically higher. So you really need to do your research, especially if you plan on moving from one insurance company to another, because the tiers that they, and the prescriptions that they assign to the tiers are different with each insurance company. Usually if you reach out to the insurance company, they might be able to send you their prescription drug formulary, and you can take a look at it and see, especially if you're going to be on a medication that you know that's going to be consistently, that you consistently have to take, or it's going to be expensive. So why do I say talk to your doctor or pharmacy if you do have really high prescriptions that you're having to pay for? So what is it? What if it's a situation where you talk to your doctor and maybe there is a different version of the medication, a generic form, maybe a lesser amount that would still provide the same service that you're getting health-wise, and give you less out of pocket? Or what if you talk to your pharmacy technician and maybe there's a prescription assistance program that they can help you sign up for that you weren't aware of? In a lot of these circumstances, what I often hear from the financial counselors, the doctors, the pharmacy techs when we talk about these programs is, Jackie, if they hand over a credit card, we assume that they can pay for it and that there's not a problem. If they're not asking, we assume that everything's okay. And when we talk about coming into the clinics, there's usually so many people coming into the clinics that they're filling the prescriptions, and if they're not being asked questions, they're assuming that everything's good and they can continue to fill the prescriptions. Always, always ask. The worst that anybody can ever tell you is no, there's not any help, but at least you know you've asked and you know that there isn't any. You really want to check with your insurance companies to see if they have any special programs. A lot of the insurance companies now are doing prescription by mail. So they might be able to send you a bulk sum, maybe 3 months worth of prescriptions that they can get significantly reduced to you, and it gets mailed. Ultimately, that would be a savings to you. So you definitely want to check that out and see if that might be an option for your specific drug. A lot of the insurance companies are doing contracting or affiliating with specific pharmacies. So maybe I like to go to pharmacy A, but my insurance company has contracted with pharmacy B. I can keep maybe going to pharmacy A, but if I go to pharmacy B, it'll be maybe $20 difference. So you definitely want to look into that because there might be some significant differences, especially if it's medication that's continually having to be filled. For Medicare patients, if you want to check out Medicare Extra Help, if you have prescription Part D, this is a link where you can take a look at to see if you qualify based on income for the Extra Help program that would actually help pay for some of the prescriptions. So I mentioned the prescription assistance programs. There are definitely some programs out there. Again, I always encourage you to check in with maybe the pharmacy tech, the nurse, or maybe somebody that might have some good information that you can get a quick answer. If you're struggling to find an answer for high out-of-pocket expenses and you're still going to have to take them, these are some really great websites to check out. Needy Meds, if you type in your prescription drug, it will actually list any and all programs or grants that might be available to help you pay for the drug. Same thing for partnership for prescription drugs. GoodRx is a really neat one. If you actually type in your drug that you need to take and your zip code, it will shop and give you price comparisons for nearby pharmacies. So you might be shocked to learn that there is a difference between the same drug between different companies. For example, going to the grocery store and get your prescription drugs might be cheaper as opposed to going to an actual pharmacy to get your drug that you needed. So you might want to check in and see if there is a significant difference to see if that would help you. So I mentioned at the beginning of the webinar about copay assistance. So when we talk about insurance and out-of-pocket max and deductibles, if you are going to start chemotherapy, there may be a possibility that there may be some copay assistance companies that can help pay for the chemotherapy drugs. This is something that if you are going to start a chemotherapy regimen, you want to definitely ask if there's a financial counselor in the clinic to see if you can talk to them about this. Typically with these copay assistance programs, it is based on income and the type of diagnosis, but their income limits are set much, much higher than other programs like state benefits, like say, for example, Medicaid or any other state benefits that are offered. So a lot of times the response that I always get is, well, Jackie, I'm working, I'm not going to qualify for this. Well, you never know, because they are set, the limits of income are set so much higher that I actually have working families or individuals that make a decent wage and do qualify for these programs. So you always want to check and make sure. If you change your drug at any point in time, check back with the financial counselor. Does that change, and do I now qualify for different assistance? They may not actively see your file, and they may not see until maybe a couple weeks later that you've changed medication, and it could have been something that they could have started a new process for you. Definitely, this is something, if you're going to consider, check in with a financial counselor first. Do not do this on your own, because if you are going to get this help, a lot of times the medical team has to do their due diligence and submit medical forms on your behalf. So it's much easier if they can help you. If you do have to do some research on your own, these are some of the copay assistance companies. They may not be the full listings, but these are some of the major ones that do offer copay assistance. So what are the other things that health insurance does pay for? Do they pay for durable medical equipment? So wheelchairs, walkers. Once you've met your deductible, in a lot of these, in many of these situations, some of these services can be paid for at 100%. So once you have reached your deductible, especially if you're going to be doing the chemo regimen, then once you hit that out-of-pocket max and you're at 100% and everything is getting paid for, let's figure out what we can access while we still have 100% that's being paid for. Can we get physical therapy? Do we qualify for home health? Can we get therapeutic massage because we now have things like lymphedema? So definitely always want to make sure you check in with the doctors, because if you do qualify for some of these are typically things that the doctor is going to be ordering for you. If you've met your out-of-pocket max and you find a therapist in network, maybe going to see a counselor would be a great time to get started, because if they're in network, it's going to be paid for at 100%. And again, I mentioned this earlier, but making sure that you have access to a case manager that can be assigned to you if that is an option with your insurance company. So I've talked a little bit about in-network and out-of-network. So as much as most people do their due diligence and stay in network, there are going to be some situations where you, as much as you do your research, you may go out of network. There are some specialties doctors that may not contract with the insurance companies. And so there may be things that are beyond your control where you're going to get what's called a balance bill or out of network bill. What do you do if that happens? So let's talk about who you might get a balance bill or out-of-network bill for. Typically, the anesthesiologist, pathologist, hospitalist, radiologist, ambulance, air ambulance. Typically, in most cases, they do not contract with insurance, and you may get an out-of-network bill. Even though you stay in the hospital network, even though your doctor's in network, those may be bills that you get out of network. So why is that fair, and why do you get it? Well, in Texas right now, there is still the possibility that you can go out of network. So what do you do if you get a bill? Well, if it's over $500 and it's out of network, you can contact the Texas Department of Insurance to see if they can help you with mediations to try to lower that bill. Because it's not your fault and you stayed in network and it's something that was beyond your control. You can always try to appeal it with the insurance company and see if they would overturn it. But in a lot of cases, you might be better off trying to negotiate the bill down especially if it's over $500. If you are having a planned surgery and you check in with your doctor before you have the surgery, can you check with the doctor to see if they can let you know who the anesthesiologist is going to be, so that you can contact the anesthesiologist or figure out if they're going to be in network, or if they can help you find an anesthesiologist that's in network. They may say no, but you can always try it and see if you can find somebody that might be in network for you. So when we talk about insurance, in some cases, we do also have to talk about COBRA. So if you are employed, and your employer is the one that's providing your insurance, and you end up, for whatever reason, losing your job, you do have, in most cases, the ability to continue coverage with COBRA. It is time limited. It's typically 18 to 36 months. Most people will tell me, the first response when I talk about COBRA is, Jackie, this is incredibly expensive. I can't afford this. Well, when we talk about access to care and insurance, if you were to lose your insurance, if you, let's say you're an individual, you're not married, then you would be looking at whether or not you qualify for Medicaid. And because Texas is not expanded into Medicaid, typically the pool of people that do qualify is going to be a little bit less than if you, say, go up to New York. Whether or not you qualify for Medicaid is based on income and other criteria, or looking at the healthcare marketplace plans. So why do I really encourage people to take a look at the COBRA plans to see if it might be a good option for them? Well, let's say we have somebody who's in the middle of treatment and they have already met their out-of-pocket max, and they are in the middle of the year and they still have 6 more months to go before their insurance resets. Well, if we actually start to calculate if they went on another plan, restarted their insurance, restarted out-of-pocket max and their deductibles, sometimes what we find is that with the paying the premiums and everything else that they're responsible for, they actually might be paying more than if they stayed on the COBRA plans, even though it may seem that the COBRA plans are expensive. So you always want to check in with your financial counselors to see if they can help you go over this, or if there's a social worker or a navigator that can help you understand. So open enrollment, why do I want to talk about this? Because depending on where you're accessing your insurance, whether it's through your job, whether it's through the marketplace, whether it's through Medicare, you want to make sure to figure out what is the best plan for you. And there is no one size fits all, kind of like, you know, what we talked about in the beginning. If I have cancer and I have other health issues, maybe I might need to figure out who is going to be in my network for the cardiologist or maybe the oncologist, where I have another patient who only needs to see one doctor and only has to be concerned with being in network for that doctor. So how many doctors are you having to see? That's probably where I would start with, comparing the plans, making sure you're calling these doctors and figuring out what plans are going to be in network, or if you actually have it narrowed down, call the clinic and say, hey, Dr. C or Dr. C's office, do you accept the insurance plan as in network? Because if you find and you shop around and you actually see that if you're going to continue on with treatment and you're going to continue to hit your out-of-pocket max, do I actually benefit from looking at a different plan to see if I can save some money? If your job is connected to your insurance, maybe considering during open enrollment, if you haven't already signed up for what's called the HSA or FSA plans, seeing if these might be available for you. In some situations, some employers will actually match some money into these accounts. These accounts essentially are savings accounts. They're called health savings accounts or flexible savings accounts. The difference between the two, the health savings account, you have to build up what you're saving. So it's very much like a savings account. If I put $10 and I have $10 to access, if I put $20, I have $20 to access. So I have to build up and it gets taken out of the check. The flexible savings account might be a really good option, especially if you're in the middle of treatment and your insurance is going to reset. The flexible savings, it's still money that gets pulled out of your check, but you typically will get a lump sum of money at the beginning of the year. So if you have enough to be taken out and you get, let's say, $1,000, that's $1,000 at the beginning of the year that you can use for things like doing a PET scan that usually will cost a couple hundred or a couple thousand depending on your insurance plan. It can help you in the beginning to access a little bit of money. Definitely it's coming out of your money, out of your check, but these are things that are pre-tax. And again, a lot of these employers have incentives where if you have these plans, they may contribute some money to it, or if you do certain things like get wellness checks, they actually might give you some incentives to get more money for it. So you definitely want to check into these plans with your benefits and see what might be available. With the marketplace plans, you want to make sure that if you're shopping off the marketplace, that you are signing up for plans that are going to cover your cancer treatment. You would be surprised to hear how many people I get calls from when they have a cancer diagnosis that find out that they had signed up for a health insurance plan, but what they signed up for was a short-term or limited plans, or plans that offer a cap or a maximum that they would pay out of pocket. Typically, these plans are not going to pay for cancer treatment because it can be so expensive. So you want to make sure that if you are going to switch the plans, that it's going to be something that is going to pay for cancer treatment and continue to help you see your doctors. So I also want to talk about supplemental health plans. This typically comes up, for example, if you are employed and you're in the middle of open enrollment and you get these options to pick from these policies. These policies usually are things that you would only pick during open enrollment. So why do you want to be careful with these plans? These plans, unlike a regular health insurance plan, can deny you because you have a pre-existing condition. So you want to make sure that if you are going to sign up for these plans through your insurance or through a private insurance company, that you check to see if they have any time period that you have to go through to be able to access it if you have the cancer. Or if they will enroll you, but they're going to disqualify you from using it for cancer purposes. You really want to read the fine print on these policies, because you don't want to sign up for something that you have a pre-existing condition for, that you're going to try to access it later, and then they deny you for the thing that you're trying to use. You don't want to lose your money if they're not going to help you with these in the long run. But definitely check into them, because if they do have a time period and you're able to access it later on down the road, it might be worth looking at to see if it would be beneficial for you to sign up. So I've included some resources and references in here again for you guys to take a look at. And then I am listing my information, my direct phone number, my email, in case you have any questions that maybe we don't address today. You're welcome to call me anytime, and I'm happy to listen to your situation and see if maybe we can come up with some ideas.
Wonderful. Thank you so much. At this time, are you comfortable if we answer some questions that came in?
Absolutely.
Awesome. If you have any questions for Jackie as we are beginning to discuss, please utilize your questions tab on your control panel and we will get to your questions as well. First of all, this is just for me. I really liked the comparison you made of the hospital network, your healthcare system, to a mall. That is such a great way of looking at it, and not a way that I had ever thought of. So I learned something too. One question we had was, I know you mentioned one of the examples of why you would experience an insurance denial was because work gets sent to a lab out of network. But are there any other, I guess, triggers or causes that commonly happen as to why you receive an insurance denial?
Yeah, a lot of times in the beginning when you have a new diagnosis, you know, the clinics are doing an amazing job of getting you into the doctor's appointments and specialties as quickly as possible. Well, that's great on your end, but what's happening on the back end is that a lot of times these claims are taking a while to get submitted. And in the meantime, the insurance company is, for all intents and purposes, Jackie is healthy, and Jackie, why are you now needing a PET scan when you're healthy and you haven't been seen by anybody? They may not have gotten the claims yet, and they may need more information. So a lot of times it's just a simple call, usually from the clinic, and saying, hey, look, she has a diagnosis. We're moving her around pretty quickly. We're going to be submitting the bills, but she has an actual cancer diagnosis, and now she needs to move forward with that. Honestly, that's usually the majority of the time when it gets a denial. that I hear, and people usually are calling in panic mode saying, why is it denied? Why is it denied? And it's usually just a simple phone call to make.
Okay. And then you were also talking about getting your prescriptions filled, and there is the possibility of getting months in advance filled all at once and how that might save you some money. Where can you go to find out if you are eligible for this?
That's a great question. Whatever insurance company you have, you can actually call them directly, or if you have access to the internet, I would encourage you to create a internet account and log on and create an account with the actual insurance company. I know this because we actually had our benefits counselor come in yesterday, and she told us about within their website for the insurance that I have selected, they have another vendor that actually does the prescription through mail. So I would go into the website, type in the prescription, and if it's available, then they would make it accessible through that website or by calling the insurance company.
Awesome. All right, and we just had one more question. Whenever you were discussing, after you hit your deductible, there was those list of items that insurance can sometimes cover. Is there some fine print we should be looking for, or who can we contact within the insurance company that can help us find out what is available to us once our deductible is met?
That's really a great question. So it really is going to depend on the insurance companies. I can tell you the wigs are not getting paid as often by the insurance companies. That has changed, and that typically changes year to year. So if you can't have a case manager assigned to you, I would tell you get the case manager assigned, because that would be my quick resource of, hey, I'm trying to get this done and I need to access this. Does it pay for it? You can assume for the majority of situations, if the doctor can order it, typically it will be paid for by insurance.
Okay.
The doctor cannot order it. So things that the doctor cannot order that I usually get requests for are going to be like, maybe I need extra help in the home, or I need help bathing or grooming. That typically is called what's called care aid or respite care. It's not a skilled need, and it can't be ordered by a doctor, so usually it's not going to be paid for by insurance. That would be an out-of-pocket expense. But really great question, because sometimes there's some really obscure things that you don't think about that you find out later that they pay. That you can access.
Yep, exactly. Wonderful. Well, thank you again for joining us tonight and for presenting. I know insurance is just one of those topics that we need, but it's most likely just misunderstood. So thank you for shedding some light on it.
Thank you so much, Kelly.
And I just encourage everyone who is on this webinar tonight to stay connected with the foundation, visit our website, like us on Facebook, some upcoming events for you to be looking out on and to get involved in. We have our Survive and Thrive Symposium in Beaumont on November 3rd, and our upcoming webinar is November 8th. And we will have Nicole Hodak with us, and we're going to be discussing nutrition, ways to eat healthy on the holiday, but keeping your budget in mind. So be sure to keep up with us and check out those events coming up. As we bring this webinar to a close, a survey is going to open on your screen. Please take a few minutes and just provide us with feedback on today's presentation. Give us ideas for topics that you're interested in seeing covered in the future. And thank you again for everybody that joined us this evening, and y'all have a great rest of the night.